So welcome back, everyone. Yoo-hoo! If you hear that, then you know that we have Michael Henderson. He's the owner of Tapestry Insurance Group. You know that he's in when we hear that sound. We love to have fun, but we have to talk about a serious subject in a fun way. Tell us a little about, yes! Woohoo! Tell everybody a little bit about yourself.
We work in the Medicare space, so we help people with, interpreting Medicare is what I like to say, because it's such a hard thing to navigate. A lot of times people, we're on an insurance plan through our employer our entire life or whatever it might be, and we really don't know what it takes to shop for insurance. I mean, except for maybe auto insurance, but our health insurance, right?
Right.
So people go on to Medicare, they get a lot of books and things in the mail and don't know what to do with them, and that's where we come in.
Well, you know what I love about you? First of all, you are a seniors advocate.
Woo.
He really, truly is, and you've been doing what you do for years. I know you've been coming on my show for over 7. We're not figuring it. We've never been able to figure out exactly, but you like to help people understand and educate. You are all about educating people out there and understanding why it's so important. This is something that you've said many, many times. Speak to somebody local.
Yes. Yeah, there's a lot of ads on TV, a lot of ads on the internet, and those are great places to get information. The internet, people go there all the time to search stuff out. But when you're actually looking at things to make a decision, it's good to talk with somebody local that knows the markets, knows maybe doctor networks, hospital networks. It's not going to cost you any more money. The policies that are set from the carriers and things like that are the same if you call the carrier directly or go through a local agent who can help you out.
Now, you are a free service to the people that are listening. People say that's too good to be true.
We get paid from the carriers. So for us, when we educate you, it doesn't matter what you choose because they all pay us the same. But you as the client who we're talking to don't have to pay us anything.
And when you talk to Michael, here's the thing is that you're going to call him and leave a message.
Yeah.
We want everybody to understand that it's so important that you leave it. And you know what? We never had to talk about this years ago, but now we do because no one leaves a message anymore. They think the phone call is good enough. That's not nice.
Yeah.
Don't do that.
Well, we just can't call you back unless we have what's called a permission to call. So if you get the voicemail, leave a message. You'll call our office if you call the number that we give out here, and you might talk to Norma, our office manager, as well. But either way, we're going to get you connected with a local agent in your area.
And you service the entire Southwest.
Yep.
And so when you call, you leave a message. Michael, I know that you do like to talk to a lot of the people just because you want to understand what their needs are, and then you can kind of help them, guide them to the people that are under you, that work with you. They're little Michaels running around there. Go ahead.
Yep.
And, too, that they can get somebody in their area, too.
Right.
This is very important.
Yeah, it is. I do like talking to everybody that I can, obviously, but that ship sometimes is sailed just because we get so much, we do so much for people in the community. So you might get the office manager, but we're going to connect you with a local agent. If I can't talk to you directly, we're going to connect you with one of our agents that knows your market and knows what's going on so they can help you out.
Write this number down, put it in your phone, and I'll tell you why it's so important to have this information. Because number one, we've said this before, first of all, every day is a Medicare day.
Yep.
Somebody turns 65 every day. So there's people that are turning 65, there's people that are already in Medicare that you can also help them if they have questions.
Sure.
I know that there's certain times when people can and can't change things, but you know what? The best thing to do is put this number in your phone, have that consultation. It is a free service to you out there. It's 480-847-0701. He services the entire Southwest, basically everywhere you're serving.
We're actually able to serve anybody in all 50 states, but we specialize here in the Southwest. We have agents from Colorado all the way through to California, and so we work with people all over the West here.
I got something to talk to you about.
Uh-oh.
Okay.
Uh-oh. That sounds no.
Well, I'll tell you what it is. My ex-husband, who is a senior,
Mm-hmm.
okay, and he was on Medicare, or he is on Medicare, I should say it that way, but wanted to pay as little as he had to for the part of the secondary, I don't know what you call
The
those.
Part B, or, the Advantage Plan or Supplement Plan?
Yes. So he ended up paying less money,
Mm-hmm.
but owing more when something happened. I think his deductible was. Is it always smart for people to pay less money, or what is it? What do you think about that?
Yeah, I mean it depends on the
boiling.
person. You know, it really depends on the person, their financial means, and their medical stuff, right?
Mm-hmm.
So, yes, it can be very beneficial to go on a low price. There are plans that are zero additional premium. You pay your Medicare premium and that's it. There are plans like supplement plans who have an additional premium over and above, and it really just depends on what your needs are medically and financially. And that's part of sitting down with somebody. There are a lot of people on a plan that they're all good plans. I mean, there's nothing that's going to really mess somebody up too bad, but there are plans that may be better for you than another one.
Right, and you don't know, I said this earlier, you don't know what you don't know.
Exactly.
And we've
Yeah.
said that many,
Yeah.
many times on this show, and it's so true. And here's the thing though, it's all about having the conversation with somebody who's educated like you, so you can give that person that's sitting across the table from you or on the phone or however you're gonna meet with them now, to give them the advice and the education part that you know so well,
Yeah.
right?
I'm
So
just
that
impressed
don't
you called me educated.
Woohoo! Well, you know, you are, and you've been doing this a long time, and you love what you do.
Yep.
You absolutely love what you do.
It's so important. I fell in love with it. I've told the story many times after my very first appointment with somebody who hated Medicare, hated the government, hated doctors. So that was an interesting first appointment. But it was.
And she didn't sign
She
right
didn't,
away,
she
right?
didn't enroll with me, but it was a very eye-opening situation, and it told me what was really needed in this industry, and that is somebody that cares about our Medicare eligibles and cares about educating them and helping them out.
Right, and
so-
and as I was talking to you about my ex, I was just thinking about something else too with him, is that he got sick.
Yeah.
He was fine, and when he enrolled and did everything he had to do, he didn't need that.
Mhm.
But then, boom,
Yeah.
something changed, and that is also having somebody local here, being able to call Michael and say, "Hey, Michael, I just ended up with, my gosh, I just got a new prescription," or what have
or
you.
doctor or a new situation. It happens all the time. You know, and again, there's not a bad plan out there, but there may be a plan that fits better for you. And the thing is, you know, we quote out our homeowners insurance, we quote out our auto insurance every year or two, but people tend to land on a health insurance plan and they never look to see if it's still good for their situation. You know, if your prescription drugs change or you have a new diagnosis, you need to look at your plan to see if that's going to be the best one for you still. There are plans out there that are specifically for diabetes and things like that. So, you know.
Yeah, no, I think it's really important that you don't, number one, we've said this before, don't ask your neighbor. You know, you and your significant other, both of them could even be on a different
Different
plan,
plans,
which
sure.
we talked about that
Mhm.
before. There's so many things and reasons. We talked about Dr. Google earlier.
Yep.
That's also a place you shouldn't be looking. Too much. I mean, you
Good
can
place to
go
get
look.
information, yeah.
You get some information, but I think what the doctor said earlier is it's overload. It's overloaded. It's too much. Do
Yep.
you know if it's right for you? And that's where you come in.
Exactly. Yep.
So you
We
can
hope
call. You do. And one thing about Michael is he is your seniors advocate. He also makes a serious conversation easy and fun, educational. That's what he's all about.
Yep.
And if he can't help you in the area when if you're in a different area, he has all of these people that can help you. He will help find you someone in your area. Call somebody local. It's really important. We're going to go to a break. When we come back, we're going to talk further about also why people shouldn't call the 800 numbers, because there's a ton of those too. You get inundated once you start.
kinds of
Not
stuff.
even when it starts happening when you turn 60. All of a sudden, all this stuff comes
More
in
and
and
more,
like
yeah.
they make you older than you really are. Put the number in your phone. It's 480-847-0701. Woohoo! Leave a message, because he can't call you back if you don't leave a message.
Yay.
Okay, we're still live in the room.
Yes, we are.
So,
Being alive is good.
being alive is good. It's very true.
We have a fax that just came in.
What is that? Woohoo! Oh my God.
Ric Flair?
Woo! Oh my God. You want that? No. He is so funny. That is what happened. He ended up getting really sick.
Yeah.
And he is on this plan, and he's sort of like sorry. He also tried to speak to somebody, from what I understand, and I don't think they gave him the time of day that he needed.
Yeah.
And it ended up that he just stayed with what he had.
Oh, yeah.
He didn't know that maybe he could have changed or what have you, or how to go about that.
Depends
even.
on the timing of it.
Yeah.
Yeah, that's a problem. I think, especially if it's a call center situation, first of all, you never talk to the same person twice if you call an 800 number. So they're not gonna know your situation and all that. You have to re-educate them every time. So that's part of it. Working with an agent, working with a person,
A person and not a thing.
Yeah, that kind of can remember your conversations or look you up in their database or
Right.
something like that. Definitely can help streamline things.
Oh, it's so much nicer to have somebody who cares,
Yeah.
somebody who's
Yeah.
listening and keeps your information on file so they know what you're going through and they can look back
Yeah.
and understand and
Yeah.
what have you.
Yeah, it's like when we evaluate somebody's, say, prescription drugs, the first time's always the hardest because, somebody might have a list of 10 or 15 prescription drugs sometimes, and we have to work with all those, but then after that it becomes a lot easier because then we can just say, oh, what's changed, are you still taking these 10 prescriptions? Oh, I'm off of this one and I added this one or something. And then that conversation, we already have the baseline for it. Now when we review it the next year, it just is so much easier.
Let's say somebody does go off, they just took them off, so you just mentioned something, and let's say they do. Do they call you now or do they call you what do they do?
Well, call us anytime, but in general, you can change, for most people, you can change during annual enrollment.
Okay.
If you're already on existing Medicare. But there are instances where you can change, like if somebody got diagnosed with diabetes, they could possibly change plans in the middle of the year.
What do we talk about that?
So there's lots of intricacies, but it's personal specific. Holy moly, there I am again. No. Oh, it's still got my old number on there.
Hmm?
Still got my personal number on there.
Oh, we can
Which,
change
no,
it.
it's fine.
Welcome back.
We're back.
We are back. Woohoo! And when you hear that, you know that Michael Henderson is on. He's the owner of Tapestry Insurance Group. And we talk at the break. And, I've said this so many times, and I know because my ex-husband, because he's a senior, so I know what goes over close enough to hear these things. And somehow, people who are older, who are seniors, love to talk about that.
Yeah.
They love to talk about all their health problems, and they love to talk about what medications you're on, who are you using, who are you with, and it's great that you're all doing that, but you might be getting some of the wrong information. And one of the things that you mentioned, this is kind of interesting, and this didn't happen to him, but the fact that you brought it up, I thought it was a good idea to bring it up for the people that are listening now.
Mm-hmm.
And that is that you might be diagnosed with, you said, diabetes, let's say, after you've already enrolled. After that time period has come and you think that you can't change, but you might be able to.
Yeah, so, we hear a lot during, as we talked about on the break, annual enrollment period, or AEP, which is that October 15th through December 7th. So you see all the ads on TV and all that. What people forget or don't know is that there are lots of enrollment periods during the year as well. Now, they're not for everybody, they're person specific. So like you just mentioned, let's say somebody gets diagnosed with a chronic condition like diabetes during the year. That's an opportunity to change plans to a diabetic specific plan, for instance.
Mm-hmm.
There's different ones of those for conditions. There's also election periods for moving, for retiring, like if you worked after you were 65 and you're on your employer group plan, you could change, let's say you're retiring from your employer at 70, obviously that's an enrollment period as well. So there's lots of enrollment periods during the year that don't get talked about as much as AEP, because that's the time you see all the ads.
Yeah, that's the big senior time.
Yeah, the Joe Namath's on TV, everybody's on TV. I don't even know if he's still on TV.
He is, but he doesn't call you back, that's the thing.
Yeah, and we talked about that too, is you can go through a call center. The one big problem with that is a couple we talked about is, first of all, they're looking at selling you a plan versus educating you. We've talked about that many times. Second of all, you don't have an agent that you can call and talk to many times. You don't call that 800 number again and get the same agent. So there's no consistency with who you're talking to. So I believe the smart thing there is, again, talk with a local agent just like you do other stuff.
You said it over and over and over again, please just speak to somebody local, very important.
Hey, we'd like it to be us, but if you have a local agent, that's the battle right there. Then I've won. I just want you to talk to a local agent.
But somebody, I'm going to say this, somebody who cares,
Yeah.
please get to somebody who really is going to be looking out for you, who is that seniors advocate like Michael is. The other thing is, we had said it earlier, that
I moved my microphone.
so, of course, everything stops and we laugh because Michael Henderson's on. If it was anybody else, we wouldn't have done that.
Yeah.
So, I wanted to bring this up because, we said earlier how every day is a Medicare day. The fact is that a lot of people think people like you only work in October. That is not the case.
Yeah, worse than that, a lot of people don't even know there's people like me that exist.
It exists.
So, yeah, obviously because of all the ads, they think that that's their only time to change, so that's when they call. The other thing is, and I've even had medical professionals tell me this, and the people that have worked in hospitals or still do, and we talk about their Medicare and they're like, I didn't even know, I got referred from a friend, I didn't even know there were people like you that did this.
Right.
So it's really says a lot to me, because there's not enough positive, I guess, advertising or marketing out there that says, hey, there are people that care, there are people that want to help you with this situation, and there are people here that will and can educate you.
Absolutely, and that's what you like to do. His phone number is 480-847-0701. It's a free service to you, and he services the entire Southwest, and he is your seniors advocate. He is out there to help you understand it's incredibly complicated, and there's so many different alphabets in the Medicare soup.
In alphabet soup.
It really, really is.
There are.
And there's so many different choices. How do you know how to make the right choice?
Yeah, and it all comes down to education, which sounds really boring because I say that a lot, but it's the truth. It's education. It's boiling it down to what your needs are, not your neighbor's needs, like you said earlier, not your spouse's needs, but your needs. And to your point, there's a lot of things that are available out there. I think there's 15 different Medicare Advantage plan carriers here in Arizona, plus the prescription drug plan carriers, plus all the supplement carriers, plus understanding the original Medicare of what it does and doesn't cover as well. And so we can boil that down into easier to understand.
I'm going to tell you another plus, because you were saying plus all the time. I figured I'd say it too. Plus, there's a lot of people that don't even know what to do to get the Medicare, even to begin with.
That's actually really true too. We've actually, ironically, had more conversations, I don't know about more, but it seems like we've had a lot of conversations this year with people that are going on to Medicare for the first time that don't know how to do that in the process, and work through that.
And so you help with that as well?
We can help with that as well.
Right.
We don't work for the government, so we can't file the paperwork for you, but we can guide you on what to do.
On what to do, because a lot of people, they think it gets done for them, and it doesn't. They also think it's free.
Yeah, so that's actually a good point. Medicare is a government system, much like Social Security. You pay into it when you work during your lifetime, and if you work enough, it's 10 years, 40 quarters, 40 credits you need to qualify for Medicare. When you pay in that much, your Part A, which is your hospital, comes to you when you turn 65 for no cost. The Part B, there is still a cost for. And so you can opt out of it, but then there can be penalties and all those situations we've talked about as well. So yes, there can be some costs in Medicare too.
There are some costs, and make sure that you're speaking with somebody who is educated, like Michael is, that can help educate you on making sure, well, first of all, the other thing for seniors, it's all gotta be down to money, because you wanna save them money too. The right plan, not necessarily, I mean, I think I just said it earlier, maybe saving money isn't always the answer. Sometimes saving money, but also making sure that you have the right plan for you. It's so hugely important.
Saving money there's two parts to saving money. Well, obviously, it's not all about just saving money, like you said. It's saving money or spending the right amount of money for the care that you're getting, for the quality care, right? But also, sometimes on the surface, the money that you spend up front can save you money on the back end. So there are prescription drug plans that are, for instance, 0 premium this year for 2024, and there are prescription drug plans that are, let's say, $90 a month for just the prescription drug plan. Based on that, you'd think, oh my gosh, I want the 0 premium plan. But when we look at all the prescriptions, the formulary, the number of prescriptions on the high expensive plan is more robust. So in the end, that $90 a month plan may save you money if you're on those prescriptions that are covered down
Exactly.
Plan,
See,
right?
that's why you need Michael to help you, because you would never be able to do that on your own. That's got to be hard to do.
It would be really hard. There's so many plans. It would be hard to do.
But also just with the medications, right?
Yep.
I can't even pronounce some of them right now. Some people
you gotta know Latin. I don't know Latin.
But, so again, with Michael, you know that you're going to get somebody who is here to help you. That he is your seniors advocate. All the people that you have that work under you, that you have in the different areas, you will have somebody that is in your area that can help you find the right plan for you, because in different areas have different plans.
Sure, yeah, Arizona, well, even different counties in Arizona. Pima County is different than the plans here in Maricopa County. Up in Yavapai, it's different than down here in Maricopa County. And then, not to mention, then you go to New Mexico or California or Nevada, and there's going to be different plans available. And even a plan with the same carrier, this is a common question I get. Oh, I'm on this plan here, this carrier, ABC carrier. I'm moving to wherever. I want that same plan here.
In Arizona?
Yeah.
Oh, okay. I
want
thought
that.
you meant
Timbuktu, Florida.
Timbuktu, Florida.
That's a place. But that plan doesn't exist there. Like there's.
Even here in Arizona, they don't. You would not know that from one county to the next. It may not.
That may
Wow.
not exist in a different
That's
area.
why it's important. It's very important, especially what happens if you're moving. A lot of people move to another county easily.
But that's the thing. Then we look to find them the right fit in that. Now there may be the same carrier, the same insurance carrier might be there with a good plan again, but there may be something else that is better in that area. So.
And what would be for you today? I mean, I want you to talk about what your final words were for everybody out there. We have a couple of minutes about, what is the most important thing for you with what you do?
Only a couple minutes. No.
That's scary. You get to close the show.
It's really all about education for me, as you know, and it's boring to keep saying that, but it's the absolute truth. It's all about education. It's about getting the information that you need for you so that you're happy and have what you need to live a fruitful life and that kind of thing. So, get the information. It doesn't cost you anything. It's a phone call. If you talk to us and you're on the right plan, we also don't try to change you into another plan. If we look at everything and you're there, stay there.
Yeah, but I think please, everybody listen up. I've seen it happen. I watched my ex-husband going through it right now, and it's really sad when you feel like you have no choice. But the only thing that you need to do is pick up the phone, give a call to Michael, let him talk to you, and call somebody here and leave a message.
Leave us a message if you don't get us.
Because he can't call you back if you don't leave a message. And this is a free service to you. It makes sense to just speak to somebody. Please speak to somebody local.
Yep.
Right?
Give us a call. Doesn't cost you anything. It's worth your time.
And even if right now you might be, it's not for the, what do you call those? The annual enrollment
period. It's not
period.
annual enrollment, yeah.
But somebody turns 65 and having those questions answered, whether you have a medical question, have a prescription question, give him a call. He'll be able to talk to you and teach you all about it. 480-847-0701. Woohoo!